How does allowed amount affect healthcare balance billing? Have you ever wondered how the allowed amount impacts your healthcare bills, especially when it comes to balance billing? Understanding this concept is essential for managing your healthcare costs effectively. The allowed amount is the maximum payment that a health insurance plan agrees to pay a healthcare provider for a specific service. This amount is often negotiated between the insurer and the provider. If a provider is out of network, the allowed amount may be based on the usual, customary, and reasonable rates for that service. Essentially, it sets a limit on what the insurer will cover. Now, balance billing comes into play when a healthcare provider charges more than this allowed amount. In such cases, the provider can bill the patient for the difference. For instance, if a provider charges $500 for a service but the allowed amount is $300, the provider may bill the patient for the $200 difference. This is what we call balance billing. For seniors, especially those enrolled in Medicare Advantage or supplemental insurance, understanding allowed amounts is crucial. When using in-network providers, patients typically only pay their cost-sharing amounts, such as co-pays, co-insurance, and deductibles. In these situations, providers cannot balance bill beyond the allowed amount, which protects seniors from unexpected extra charges. However, when using out-of-network providers, the allowed amounts are often lower. This can lead to higher out-of-pocket costs due to balance billing. Some plans, like health maintenance organizations or exclusive provider organizations, may not cover out-of-network care at all. This means seniors could be responsible for the entire billed amount. Additionally, federal protections, such as the No Surprises Act, limit balance billing in emergency situations or certain non-emergency care at in-network facilities. This is beneficial for seniors as it helps reduce surprise charges that can arise from unexpected medical situations. In practical terms, seniors should always verify whether their providers are in-network and understand their plan's coverage rules to avoid balance billing. Knowing the allowed amount helps anticipate potential costs and avoid unexpected bills. Health plans and insurance for seniors often provide resources to help members identify in-network providers and explain how allowed amounts affect their financial responsibility. In essence, the allowed amount plays a significant role in determining whether balance billing occurs. It establishes the insurer's payment limit, and any charges above this amount by out-of-network providers may be billed directly to the patient. This can increase healthcare costs for seniors, making it essential to stay within network and understand allowed amounts to minimize balance billing risks.